Contact dermatitis is a skin condition that occurs when your skin comes into contact with an irritating substance or an allergen. The main points to remember are that it can cause redness, itching, and swelling, and it may develop immediately or after some time after exposure. There are two types: irritant contact dermatitis, caused by substances like soaps or chemicals, and allergic contact dermatitis, which happens when your immune system reacts to something like certain plants or metals. Treatment usually includes avoiding the irritant, using soothing creams, and sometimes taking medication to reduce inflammation. DiGeorge syndrome is a genetic condition that affects a person's immune system and development. It's caused by a small missing piece of chromosome 22, which can lead to various health problems. Key points to remember are that people with this syndrome may have heart defects, problems with their immune system, and issues with their facial features, such as a small chin or wide-set eyes. They might also have learning difficulties and low calcium levels, which can cause muscle spasms. Early diagnosis and treatment can help manage symptoms and improve quality of life. Guillain-Barré syndrome is a rare neurological disorder where the body's immune system mistakenly attacks the nerves, leading to muscle weakness and sometimes paralysis. Important points to know include that it often starts with weakness or tingling in the legs and can progress quickly, sometimes affecting the ability to walk or breathe. The exact cause is not fully understood, but it often follows infections like the flu or gastrointestinal illnesses. Most people recover over time, but some may experience lasting effects. Treatment usually involves therapies like intravenous immunoglobulin (IVIG) or plasmapheresis to help reduce the immune response and support recovery. Hemolytic uremic syndrome (HUS) is a serious condition that affects the blood and kidneys, often following an infection, usually from certain types of bacteria like E. coli. Key points to remember are that HUS causes the destruction of red blood cells, leading to anemia, a lack of red blood cells, and can also cause low platelet counts, which are important for blood clotting. This condition can result in kidney damage and may lead to kidney failure, especially in children. Symptoms include diarrhea, often bloody, abdominal pain, fatigue, and swelling. Treatment focuses on supportive care, such as hydration and sometimes dialysis for kidney support, and it's important to manage any complications that arise. IgA deficiency is a condition where the body does not produce enough immunoglobulin A, IgA, a type of antibody that plays a crucial role in the immune system, particularly in protecting mucosal surfaces like the gut and respiratory tract. Important points to remember are that people with IgA deficiency may be more prone to infections, especially in the sinuses, lungs, and gastrointestinal tract, but some may not experience any symptoms at all. It is often diagnosed through blood tests that measure antibody levels. While there is no specific treatment for IgA deficiency, managing infections and maintaining good health practices are essential for those affected. Understanding this condition is important because it can sometimes be associated with other autoimmune disorders or allergies. Onchocerciasis, also known as river blindness, is a parasitic disease caused by the Onchocerca volvulus worm, which is transmitted to humans through bites from infected black flies found near rivers and streams. Important points to know include that the infection can lead to severe itching, skin rashes, and in some cases, vision problems or even blindness if the worms affect the eyes. The disease primarily occurs in certain tropical regions of Africa, Central America, and parts of South America. Diagnosis is made through skin tests or examining blood samples. Treatment typically involves the use of medications like ivermectin, which helps kill the larvae and reduce symptoms. Preventing bites from black flies and improving living conditions in affected areas are also important in controlling the spread of the disease. Osteomyelitis is an infection of the bone that can happen when bacteria or fungi enter the bone tissue, often through an injury, surgery, or from nearby infections. Important points to remember are that it can cause symptoms like pain in the affected bone, swelling, redness, fever, and sometimes drainage of pus. It can occur in any bone in the body, but is most common in the long bones of the arms and legs. Diagnosis usually involves blood tests, imaging studies like X-rays or MRIs, and sometimes a bone biopsy to identify the infection. Treatment typically includes antibiotics to fight the infection and, in some cases, surgery may be needed to remove infected tissue. Early detection and treatment are crucial to prevent complications and promote healing. Osteomyelitis is an infection of the bone that can occur when bacteria or fungi invade the bone tissue, often due to injury, surgery, or nearby infections. Key points to remember include symptoms like pain in the affected area, swelling, redness, fever, and sometimes pus drainage. Diagnosis usually involves blood tests, imaging, like X-rays or MRIs, and sometimes a biopsy to identify the infection. Treatment often requires antibiotics, and in some cases, surgery to remove infected tissue. Pneumocystis jirovecii pneumonia, PJP, is a type of lung infection caused by the Pneumocystis jirovecii fungus, commonly affecting people with weakened immune systems, such as those with HIV, AIDS, or undergoing cancer treatment. Important points include symptoms like cough, difficulty breathing, and fever. Diagnosis typically involves chest X-rays and tests of lung fluid. Treatment usually consists of antibiotics like trimethoprim sulfamethoxazole, TMP-SMX, and sometimes corticosteroids to reduce inflammation. Both conditions require prompt medical attention to prevent serious complications. Primary tuberculosis, TB, is the initial stage of an infection caused by the bacteria Mycobacterium tuberculosis, which usually affects the lungs, but can also impact other parts of the body. Important points to remember are that primary TB often occurs after a person breathes in the bacteria from the air when someone with active TB coughs or sneezes. Many people may not show symptoms immediately, but some might experience a mild cough, fever, fatigue, or weight loss. In some cases, the immune system can control the infection, resulting in a latent TB infection where the bacteria remain inactive in the body without causing illness. Diagnosis typically involves a skin test, blood test, or chest X-ray. Treatment usually involves a course of antibiotics taken for several months to ensure the bacteria are completely eliminated and to prevent the development of active TB disease. Pseudomonas aeruginosa infection is caused by a type of bacteria known for being resistant to many antibiotics and is often found in damp environments, such as water and soil. Key points to remember are that this infection can affect various parts of the body, including the lungs, skin, urinary tract, and bloodstream, and is particularly dangerous for people with weakened immune systems, such as those in hospitals or with chronic illnesses. Symptoms depend on the site of infection, but may include fever, chills, difficulty breathing, or a greenish discharge from wounds. Diagnosis typically involves lab tests to identify the bacteria in samples from the infected area. Treatment usually requires specific antibiotics, and due to its resistance, doctors may need to use a combination of medications to effectively combat the infection. Early detection and appropriate treatment are crucial to prevent serious complications. Schistosomiasis is a disease caused by parasitic worms known as schistosomes, which are found in freshwater lakes and rivers. Important points to remember include that people can get infected when they come into contact with contaminated water, allowing the larvae of the worms to enter the skin. Symptoms of schistosomiasis can vary and may include abdominal pain, diarrhea, blood in the urine or stool, and fatigue, depending on which species of schistosome is involved. Chronic infections can lead to serious health issues, such as liver damage, kidney problems, or bladder cancer. Diagnosis is usually done through blood tests or stool-urine samples to identify the eggs of the worms. Treatment typically involves medications like praziquantel, which effectively kill the adult worms. Preventing schistosomiasis mainly involves avoiding swimming in contaminated water and improving sanitation in affected areas. A transplant reaction occurs when the immune system of a person who has received an organ or tissue transplant recognizes the new organ as foreign and attacks it. Important points to remember include that this reaction can happen right after the transplant, acute rejection, or may occur slowly over time, chronic rejection. Symptoms of a transplant reaction can include fever, swelling, pain in the area of the transplant, and a decrease in the function of the transplanted organ. Doctors often use immunosuppressive medications to help prevent these reactions by suppressing the immune response, allowing the body to accept the new organ. It is crucial for transplant recipients to be monitored closely and to follow their treatment plans to minimize the risk of rejection and ensure the success of the transplant. Toxic shock syndrome, TSS, is a serious medical condition caused by toxins produced by certain bacteria, most commonly Staphylococcus aureus and Streptococcus pyogenes. Important points to remember include that TSS can occur in anyone, but it's often associated with tampon use in menstruating women or after surgery and skin wounds. Symptoms of TSS typically develop quickly and include high fever, rash, low blood pressure, confusion, and multi-organ failure. Diagnosis is usually based on clinical symptoms and laboratory tests to identify the bacteria or toxins. Treatment involves hospitalization, where patients receive antibiotics to fight the infection and fluids to stabilize blood pressure. TSS is a medical emergency, and early recognition and treatment are critical to prevent severe complications or death.